Hello and welcome to our broadcast. I'm your host, Brett Barrow, founder and CEO of HerFeed. As a reminder, the information provided during this event is for educational purposes only. It is not intended, nor is it implied to be a substitute for professional medical advice. As always, please consult your healthcare provider to determine the appropriateness of the information for your own situation. If you have any questions regarding medical conditions or treatment plans, please consult your physician. Participating in this event with this clinician does not create a physician-patient relationship. Joining me today for this live event will be Dr. Jason Tarpley. Hello. Vascular and interventional neurologist who serves as the director for Pacific Stroke and Neurovascular Center, Pacific Neuroscience Institute at Little Company of Mary. That is a long title. Thank you so much for being. Thank you so much for being here today. You know, before we really delve into all of this, can you tell us what your role is at Little Company of Mary?
Sure. So I'm a neurointerventionalist, which means that basically I navigate a small catheter. I tell people about the size of like an iPhone charging cable.
Wow.
The artery of the wrist or the artery of the leg and up into the arteries of the brain to do interventional procedures. And I think relevant to today's topic, one of the main procedures we do is when someone's having a stroke, an ischemic stroke, which is a blockage of an artery in the brain. One of the main things we do, and maybe 20 or 30% of the kinds of cases I do, are actually navigating those catheters up into the brain to pull those clots out. So we're interventional stroke doctors, and that's what I do professionally. And as you said, I direct the Stroke and Neurovascular Center at Pacific Neuroscience Institute.
So I guess, you know, we can't really ignore the fact that we're still in the midst of this global pandemic. How has your job changed a lot throughout this whole COVID-19?
Yeah, it's a great question. I mean, it's changed a lot, but a lot of it's the same. So, you know, it's changed in the sense that we're really careful with patients. We want to make sure that we don the personal protective equipment to protect ourselves, our staff, and our patients from COVID-19. And one of the changes we've seen, unfortunately, is that actually a lot of patients are, even when they have a stroke, they're sheltering in place, which, you know, is good. But when you're having a stroke, you really need to go to the hospital. So they're avoiding public places, including hospitals. And so we actually have seen a decrease, maybe 20 or 30% in the number of patients who are actually coming to the hospital. So I think that's one change. We're really trying to get the message out because we take every precaution to make sure that we protect our patients from COVID-19, and we do all the CDC recommended guidelines to do that, but we're still seeing a decrease in the patients. The other thing that's different is there is an incidence, you know, COVID-19 actually does increase your risk of having an ischemic stroke. And so we're seeing patients who have COVID-19 and who have strokes. But then certain things are the same. So the treatments for stroke are still the same. So we still are able to deliver these life-saving and brain-saving treatments. So those things are the same.
I guess actually quickly just going back to Little Mary, but or Little Company of Mary, how is Providence Little Company of Mary Torrance, the stroke center, different than other local stroke centers? Because I think that will help also help shape this conversation a little bit.
Sure. Yeah. I mean, I think so. Stroke centers in general are sort of there's a tiered certification process for stroke centers. So Providence Little Company of Mary is the top tier you can possibly get. It's called a Joint Commission Certified Comprehensive Stroke Center. So there aren't many of those in the country. Most hospitals are not a Joint Commission Certified Comprehensive Stroke Center. Basically means we can take care of any kind of stroke that is out there, whether it's a ruptured aneurysm, a hemorrhage in the brain, a large blood vessel blockage that requires me to go up and snare the clot and pull it out. I think the other thing that probably separates us in Los Angeles is that in terms of thrombectomies, we do more of them than any other hospital in all of Los Angeles. So this is something we're really, expert at.
In general, because I think, people that there are certain symptoms that I think we've all sort of been told to look out for in terms of a stroke, but are there, what are the common symptoms? And then, if someone thought that they were having a stroke, do they go to urgent care? Do they go to the ER? Do they come to you? Like, what do you do if you're in, especially
the short
right now?
answer is you call 911. So we've worked very closely with LA County EMS. Their director is Dr. Marianne Gaucher Hill, and she set up a very streamlined process whereby if you're having stroke symptoms, you get brought to the nearest appropriate stroke center. So it's actually very important to call 911.
Okay.
I recommend driving to the hospital. And in fact, when you call 911, as soon as you get in that ambulance makes base contact with our hospital and starts telling us your story. And it actually helps us kind of mobilize our team so we can act really quickly.
So you're prepared for the patient coming in.
We begin the conversation as soon as they pick up the patient. So it's actually a really tight collaboration between our hospital and LA County EMS.
That's amazing.
Can really be ready when the patient gets there. So you asked the symptoms. I think the simplest is the acronym FAST, right? If everyone can remember the acronym FAST, which F stands for facial droop.
Okay.
Stands for arm weakness. S stands for speech difficulty, and T is time to call 911. Then the vast majority of stroke patients will get to the right place at the right time.
So if you think you're having a stroke and you call 911, you're just supposed to say, I believe I'm having a stroke. And then they'll in theory, they'll take it from there and actually help so that you don't, there should be that reassurance that you're going to be, people will do what they can to help you, even though we're going through all this.
Absolutely. It's a very refined system. It's been around for a long time, and it's a very practiced pathway. And so we know exactly what to do. LA County EMS knows exactly what to do. And I think probably most importantly is a good message to get out today is that, you should be sheltering in place. You should be avoiding public spaces. But if you think you're having a stroke, you call 911, they're going to keep you safe. We're going to keep you safe at the hospital and treat your stroke.
I feel like that is really important. I was reading something a few weeks ago about how, and we've actually had previously a lot of conversations about how people have been scared to go to the ER or call 911, and then there are lives lost because of that. What have there been any recent changes that you've seen or studies that have come out in terms of the care and treatment to stroke patients?
You mean in COVID-19?
Yes.
Yeah, so I think it's an interesting virus that it very much seems to selectively injure the lining of the blood vessels called the endothelium. And that lining, the integrity of that lining is actually really important for prevention of clots to form. Okay. And so if you can imagine in a coronavirus patient, it's very common that we see these, it's more common than you would expect that you see the endothelial injury results in little clots that form throughout the body or microthrombus formation is kind of what we call it. So, for example, in patients, there have been autopsies in patients who've died from coronavirus where they find little clots in the lungs. Oh, wow. And we're seeing things like when you have a central venous catheter, someone has an arterial catheter in somebody with coronavirus, that those things are clotting off more than we had sort of experienced with other patients. And so, now what we've seen, there's been more data on this that we see that actually there's an increased risk of stroke in coronavirus patients.
I was just going to ask, is that also something that?
Yeah, so those clots, we think what's happening is those clots that are related to endothelial injury can can form anywhere in the body. They could even form in the brain, but they can also travel to the brain. So we are seeing an increased risk of that, and that's something it's something that people should be aware of. I think the kinds of patients we weren't seeing before are, like as a stroke doctor, most of my patients are older patients. Like, yes, young people do have strokes, but what we're seeing now is that in patients who are young, don't have a ton of risk factors, but they have coronavirus, then they can also have a stroke.
Oh, wow.
Yeah,
so that
actually
has to change.
That was something that was initially reported in New York, where obviously the incidence and severity is much higher than it is out here.
Right.
But we're seeing it now too, as the numbers continue to climb. We're seeing young patients. There's a protein in the blood that is a sort of a surrogate measurement for clotting called the D-dimer. Young patients with really elevated D-dimers and strokes.
Wow. That's crazy. I feel like every day I hear something else about COVID-19 that just kind of blows your mind away.
Yeah.
What about, if someone is suspected to actually have coronavirus, regardless of their age, what are the precautions? Or actually, let's just say that someone is positive for coronavirus. How are they treated in the emergency room if they also are presenting?
Oh, I lost you.
I'm so sorry.
No, that's okay.
I was saying,
that's a great question. So the question is, how do we treat people with coronavirus differently in the emergency room? And it's actually very relevant to the discussion we had about, stroke patients in general. In general, a stroke patient is not going to have coronavirus, right? It's, even though coronavirus patients are at increased risk of stroke, most of the stroke patients who come in are not going to have COVID-19. So I think one thing you have to understand is that we take every precaution to keep those patients safe and separate. So when there's a whole, wing that's dedicated to patients with signs and symptoms of COVID-19, someone who comes in with stroke-like symptoms doesn't go there. They go to our dedicated, we call it the neuroresuscitation room, which is and where they get a quick exam, and then they get whisked off to a therapy like the one I provide. And then, of course, we get a stack COVID test on those patients, and we clean the room as if they're COVID positive. So we treat everybody as if positive until we find that they're not COVID positive.
Oh, wow.
So I think that I would feel very safe. I think that's one thing. I would feel very safe going to the emergency room. And I think it's very clear that if you're having a stroke or stroke-like symptoms, you call 911 and they'll get you to the right place and it will be safe.
How does the risk of acute ischemic stroke compared with patients that have coronavirus versus dealing with patients with influenza?
Yeah, okay, so that's a good question. There's a paper that specifically addresses that. So, this thing I told you about where the virus seems to injure endothelium, the lining of the blood.
Yeah.
Well, it's not really a new thing. A lot of viral illnesses seem to cause inflammation of the endothelium. And I think early in the course of, like, for example, we would see that in flu patients and influenza patients, we see an increased risk of stroke. And it's actually why when you have, we actually promote influenza vaccines as one of the things you can, one of the advantages is you can actually decrease your stroke risk. But so when people started seeing coronavirus associated strokes, I think a logical question was, well, like, is this any different than, your typical flu virus in that it increases the risk of stroke? And there was a paper in JAMA that showed that it's definitely different. So they looked over about 2 months, and they saw a very small rate. And so 2 months of patients, one of the groups of patients had influenza, and they just looked at their risk of stroke over the course of 2 months. I think it was March to April. And they saw that it was 0.2% of those patients had strokes. However, if you look at over the same time, the coronavirus patients, it's 1.6%. So it's actually a much higher risk of stroke. Wow. And 1.6% would seem like a relatively low risk of stroke, but we're talking about only over 2 months. So, this is that I think very clearly increases your risk of stroke more than other respiratory illnesses or viral illnesses like influenza.
Well, and then you also said that it's also impacting younger people too. So it seems like there's just there's more people are at risk to have a stroke than probably before, I would assume.
Yeah, for sure. And the age is something that's freaking us all out a bit, right? So you're seeing young patients who,
I ask, really quick, what was before you go into that, what was like the average age of someone that would have a stroke before, just to kind of give people an idea of, because I feel like you're going to say there's a big difference here.
Well, I don't know if the average age has changed much, because still most strokes are not COVID-19 strokes. Okay. You can drink your coffee, by the way. As coffee is
it's okay.
That's fine. If I had one, I'd be drinking it.
I totally just forgot that we were even doing this live.
Yeah, that's all right. No, I think that I don't know the exact age of the median age of stroke, but obviously stroke is more common in patients, 65, 75, 85, 95, in those age groups. So there are a few oddball causes that can cause stroke in the young. And certainly COVID is on the forefront of that now. Brett, do you see these questions from Melissa in the chat?
I'm not actually.
Oh, I can. Let me answer those.
Oh, here we go. Actually, I got one. Oh, okay. Yeah. What is the relationship between AFib and stroke as it relates to COVID?
Okay, this is a really good question. So I guess a listener asked. Yeah. So atrial fibrillation is it's apropos to your question. So in patients over 65, atrial fibrillation is a very common cause of stroke. It's a heart rhythm where clots form in the heart, and then they can travel up and block arteries of the brain. So in terms of the procedures I perform where I navigate catheters up and pull those clots out, very commonly it's because the patient had underlying AFib. But the question is, what's the relationship between AFib and stroke, and as it relates to COVID-19? So the way I see COVID-19, it actually increases your stroke risk, in a way that's, if you have AFib, it probably makes you more likely to have a stroke. So it's not that the COVID is causing the stroke, and even in the literature, we're seeing that. Yes, we are seeing strokes in young patients with COVID, but my sense is that it actually just is one more factor that increases your likelihood of stroke. So as you can think about it physiologically, if you're an atrial fibrillation patient and you have endothelial injury related to COVID-19, you have a baseline stroke risk related to atrial fibrillation, and that probably goes up when you have COVID-19.
We also have another question. Yeah, that was a great question. We also have another question. Are you, is protocol, or do you guys place COVID patients on blood thinners to prevent a stroke?
Oh yeah, that is a great question. I know I say that about them all, but so if you think about it, as we just discussed, patients who have COVID-19, especially the sick ones in the hospital, certainly not the ones that are relatively mild illness at home, but the sick ones in the hospital are at increased risk of microthrombosis and forming clots in the arteries. And those clots can go to the lungs and cause hypoxia, or those clots can go to the brain and cause stroke. So what if we put patients on blood thinners even before that happened? There's no data on this, and there's no consensus on it yet. I will tell you that we are doing it empirically in our hospital. So what that means is, if a patient comes in and their D-dimer, remember I told you that D-dimer is a surrogate for clotting in the blood. If your D-dimer is really elevated, we will actually put you on a heparin drip, which is a blood thinner, in hopes that we are preventing strokes and other thrombosis, other clotting. There's no evidence yet that this works, but there are actually randomized trials. So if you look at like the American Hematology Society, they recommend that that we think about enrolling these patients in clinical trials that are actually testing that exact question.
Wow. If you kind of going back to, I guess, all of aside from COVID, what are are there things that we can do maybe in a younger demographic or whatever just to basically prevent strokes? Is there things like what can we do or what can younger people do, COVID aside, to prevent getting a stroke at some point?
Yeah, I think, basically it's stuff that you already know, but sometimes it's good to hear it from a stroke doctor. It's the things that are good for your body are going to be good for your brain. So we know that daily exercise clearly reduces your risk of both ischemic and hemorrhagic stroke. So the blood blockage, ischemic stroke is a blocked pipe and hemorrhagic stroke is a burst pipe in the brain. We know that exercise decreases your risk of that. There's some debate about how much exercise, but basically, I think the more you can do, the more you can comply with, the better. We also know that that diet makes a big difference, and in particular, I encourage people to use and to read about the Mediterranean diet. It's a great way to have a heart healthy, brain healthy diet and not sacrifice taste if you're a foodie, right? I'm someone who, lives to eat rather than live.
Eats to live, yeah.
So the Mediterranean diet actually, represents probably about a 20% risk reduction for stroke. So that's actually pretty impressive. And then, I think the other thing that's really worth mentioning now is that, you were talking about young people, but also older people. If you have stroke risk factors, including high blood pressure, diabetes, atrial fibrillation, you really need to see your primary care physician to focus on primary prevention, meaning preventing a stroke before you ever have one. And I worry that with kind of, social isolation now that people are not getting that particular care that they need.
I feel like that's probably really true, since a lot of people are less inclined to leave their house and then not going. Actually, right. I feel like, yeah. So what would you say that, if there's like one thing that you feel like is really important that you've learned from all of this during this COVID time and the type of patients you've been seeing, is there anything that you've learned from all of this, or one thing you really think that everybody should hear?
I think we've touched on
the
it.
fact that you just said the thing about actually going and seeing your primary care.
Yeah, I think in particular, you have to understand that when you're having a stroke, that comprehensive stroke hospitals have very powerful treatments that, having a stroke is devastating. You can end up without an ability to speak, without an ability to move your arm, without an ability to walk.
Yeah.
They're actually very, very treatable diseases. So if someone, but the key is that the patient has to get to the hospital fast. And so, that's the main message I would have, is that if you're having signs or symptoms of a stroke, you got to get to the hospital, because we have very powerful treatments that can save you and bring you back to normal, at least save a significant disability in many, many patients. We have basically revolutionary treatments. The one I told you about, the thrombectomy procedure, where we navigate a catheter up and pull clots out of the brain, that's one of the most effective therapies in medicine. So if there's any chance you're having it, it's just so important to get to the hospital.
Wow, that's amazing. We're actually almost out of time. Is there anything else that we got one more. Are strokes genetic?
That's interesting. I think stroke is really common. Okay, and you also have to know that ischemic stroke is the most common kind of stroke, is a blood vessel blockage, and it's so common that I have all these patients who tell me, oh, I have a family member who had a stroke. Well, most of us have a family member who had a stroke, right? And so stroke, like many diseases, is a mix. It has genetic influence for sure, but it also has many risk factors that are modifiable. So those are the ones that I mentioned before, that you can't change who your parents are, you can't change your genes, but you can change the way you eat, the way you exercise, going to the physician and getting your care for diabetes, hypertension, atrial fibrillation. So it's a good question, and basically stroke there are genetic components, but there's also things that you can do that aren't predetermined by your genes.
And they're probably, if they are predetermined, there are things that you can still lower your risk, that even if you've had a parent that had a stroke before, that may, prevent you from, like you said before, the eating healthy and things like that, that may help you so that you don't also have a stroke, right?
Absolutely.
And then, yeah. Okay. Sorry. So we're basically like almost out of time. Is there anything else that you want to add about all of this? Or
I think that's it. It was a pleasure. I appreciate you giving me the opportunity to tell people about stroke. I could talk about it all day. So thank you very much.
It's so fascinating. And I didn't realize how many different types of strokes there are and everything. Obviously the body's very complex, but this has been very educational. So thank you very much. And thank you to all of our viewers and for all the questions, and everyone for joining us today, and to everyone, as always, for sending in your questions. If you are looking for medical advice, please visit providence.org and make sure to follow us on social media at Providence on Twitter and under Providence Health System on Instagram, Facebook, and LinkedIn. Thank you, everyone, and have a good day. Bye.
Thanks, Brett.
Bye.